So I welcome you all. Okay, so today we are going to see the various types of tablet under the heading classification of tablets. Now tablets can be of various types. So they are classified majorly into the following types, such as tablets which are taken by oral route. It means the tablets which are ingested orally. Ingested. So which are ingested orally is the first types of tablets which we have. Okay. Then second types of tablet are the tablets which are used in the oral cavity, means the tablets which are used specifically for the oral cavity. So this is your first tablet, that is the tablets which are ingested orally. Second type is the tablets which are used specifically in the oral cavity, and the third type is the tablets which are administered by other routes. So the tablets which are going to be administered by other routes are classified under the third types of tablet, and fourth type of tablets which are used to prepare solutions. Okay, so this is your four types of tablets which we can have. So this one everyone should know, that is first one is the tablet ingested orally, then the tablets which are taken or used in the oral cavity, then the tablets administered by other routes, and fourth type is the tablets which are used to prepare solution. So this is the broad classification for the types of tablet. Now moving further, now let's see each of the type of tablet under each category one by one. So the first class which we have seen earlier is the tablets ingested orally. Means these are the tablets which are going to be taken with the help of water. Okay, they are going to be ingested. Okay, so example of the tablets includes firstly the compressed tablets. Second is multiple compressed tablets. Third one is enteric coated tablets. Then we have sugar coated tablets. Then film coated tablets, and the last type form tablets ingested orally is chewable tablets. So in the coming part of the lecture we are going to see in detail regarding the each type of tablets which are ingested orally, from compressed tablet to chewable tablets. Now moving to the second type of tablets. These are the tablets which are used in the oral cavity. Examples of the tablet includes buccal tablets, sublingual tablets, lozenges, dental cones. Now you may have heard about the buccal tablets, sublingual tablets, lozenges and dental cones. Okay. So when we are going to see in the earlier part of the, that is in the further part of the lecture, we are going to see each of this, okay, with example and what they are all about. Then the third type of tablets are the tablets which are administered by other routes, such as implantation tablets. So these are the tablet implants which are going to be implanted into the patient's body. Then we have vaginal tablets. Now coming to the fourth class of tablets, it includes the tablets which are used to prepare solutions. Means even though they are going to be prepared as an tablet dosage form, but when they are going to be put into a certain solvent, mainly water, they will be converted into a solution form. And the example of such a kind of tablets includes effervescent tablets, then dispensing tablets, hypodermic tablets, and tablet triturates. So what we have seen till now is the broad classification of tablet. So it includes firstly the tablets which are ingested orally, then the tablets which are used in the oral cavity, then the tablets which are administered by other routes, and the tablets which are used to prepare solution. Then we have seen the each class with the help of suitable example, that is tablet ingested orally includes compressed tablet, so it is also called as CT. Okay, then we have multiple compressed tablets, then enteric coated tablets. Now enteric coated tablets are the tablets which are going to get the content of this tablet get dissolved into the intestine. Then sugar coated tablet means we apply a coat of sugar on the tablet, so the name is sugar coated. Then film coated tablet, we use a suitable polymer to apply a coat of film over the tablet core. Then chewable tablets. Then moving towards the second type is the tablets which are going to be used in oral cavities. So it includes buccal tablets, sublingual tablets. So buccal cavity is different and sublingual region which is there in the oral cavity is different. Then lozenges we have, then we have dental cones. So in the further part of the lecture we are going to see this in detail. Then the third types of tablets are the tablets which are administered by other routes. Now this is given by subcutaneous route. Okay, sometimes that mainly you will find that this implantation tablet they are given with the help of inserted into the beneath the skin with the help of minor surgery. Then we have vaginal tablets, so these are inserted into the vagina. And the fourth type is the tablets which are used to prepare the solution, and the examples are your effervescent tablets, then dispensing tablets, hypodermic tablet, and tablet triturate. So all of this when they come in contact with the solvent, that is mainly water, okay, so they will be coming into a solution form. Okay, the starting form of the dosage form for this is tablets, but when they are going to be mixed with water they will be converted into a solution form. For example, in effervescent solution tablets you will find that there is a liberation of CO2, so there will be formation of bubbles over there, okay, due to CO2, due to liberation of CO2. Then dispensing tablets mean the tablets which are going to be dispensed to the patient, and before taking they are dissolved into the solvent, that is, and it will be converted into solution, so that is dispensing tablet. Then hypodermic means these are the tablets which are given by parental routes. So before giving to patient, okay, this tablet they are dissolved into a solvent and converted into a solution, and with the help of hypodermic needle later on these tablets are given in the form of with the help of injections to the patient. So these injections will be given with the help of a parental route. Okay, so I hope up to this point it is clear to all of you. इथपर्यंत क्लिअर आहे की सगळ्यांना?
Yes, sir.
Okay.
Yes, sir.
Okay,
Yes, sir.
now let's move to some the most interesting part. Now you may be seeing some pictures. I hope everyone in the class have seen the compressed tablets. Okay, so let's see in detail about the compressed tablets. Now these tablets are formed by compression. Okay, so as they are formed by compression method, they are also called as compressed tablet, and the short form for this tablet is CT, that is compressed tablet, and contains no special coating. So in compressed tablet there are no special coating, means no sugar coating or functional coating, which is provided by film coating, that is not applied in the compressed tablet. So these tablets, they are made from the powdered crystalline or the granular material along alone or in combination with suitable excipients. So these tablets, they are prepared with the help of the API and the other excipients singly or in combination with the excipients. Now this tablet contains water soluble drugs which after solving get disintegrated into the stomach, and its drug contents are absorbed in the GI tract and distributed whole over the body. And the classical example of the compressed tablet includes the brands such as Disprin, in which we have a drug that is aspirin enclosed into it, means the API is aspirin. Okay, then we have the second brand, that is Crocin, which is the well-known brand for paracetamol tablets. So these are the two examples for the compressed tablets, that is Disprin tablets and Crocin tablets. Now the point which we have to remember over here regarding the compressed tablet is that this they are prepared with the help of compression. Okay, they do not have any special coating, so no coating is there, so coating is not there present in the compressed tablet. Fine. Okay, and they contain powders or the other material, means the powder in the form of API or the excipients. Okay, and they are compressed with the help of suitable excipient, and majorly you will find that the API which is present will be water soluble in nature, so that when it is swallowed by the patient, the tablet get disintegrated into the stomach, and most of the contents they get absorbed from the gastrointestinal tract. And the classical example includes Disprin and Crocin. So I hope this point is clear to everyone, or do you
Yes,
want?
sir.
Okay, now let's move to the second type of tablets. So which are the second types of tablets? The second types of tablets are the multiple compressed tablets, or they are also called as layer tablets. So before going and seeing the detail, you can see in the picture over here. Okay, now for example, this tablet. Now multiple compressed tablet. So you can see this is the white color which we have. Okay, so this is white color. Then we have something which is brown in color. Oh, okay, so brown layer is also there. Then we have little bit yellowish layer in color. Okay, then again on top we have a, oh sorry, so we have only three colors. So one is yellow, one is brown, second one is, third one is white. So you can see these are the three different layers. So now normally what happens over here is there are multiple compressions done in a tablet itself. Okay, so this, that's the reason it is called as multiple compressed tablet, or you can say these are three layers. So this is first layer, this is second layer, white color is first layer, then second layer is of brown color, third layer is of yellow color, and hence they are also called as layered tablet. Fine. Now let's see in detail about the multiple compressed tablets or layered tablets. Now these are compressed tablet made by more than one compression cycle. So what is the main difference between compressed tablet and multiple compressed tablet? So in compressed tablet we go for compression only for one cycle, but here in multiple compressed tablet the tablets are compressed by more than one compression cycle. Now such tablets are prepared by compressing additional tablet granulation on a previously compressed granulation. Suppose firstly I am going to compress this white color granulation, and laterly I will move for the brown color granulation, and then for the yellow color granulation. The operation may be repeated to produce multi-layer tablets of 2 or 3 layers. So if you see this example or the picture which we have seen, so this is for of how many layers? कितनी layer चाहिए? How many layer it is?
Three.
So it is 3 layer. Very good. So we have a 3 layer tablet over here. So the operation may be repeated to produce multiple layer tablet of 2 or 3 layers. Okay. So hence they are called as multiple compressed tablets because more than one compression cycle is involved over here, and they produce a layer of 2 or 3 layers, and hence the name is also given as layered tablets. Now to avoid the, why we go specifically for the formulation of multiple compressed tablets or layered tablets, the major reason is to avoid the incompatibilities. Now suppose if I have a drug A and drug C which are incompatible with each other, but A is compatible with B. So what I can do is I will prepare a separate layer of A and separate layer of B and separate layer of C, so that if any incompatibility is there, it will not be seen into the product. The ingredients of the formulation except the incompatible material are compressed into a tablet, and then the incompatible substance along with necessary excipients are compressed over the previously compressed tablet. So from this, what is it clear to you that how we prepare the compressed tablet? See what we do. Normally you will find we go for multiple compressed tablets or layer tablets to avoid the incompatibility. Now the ingredient of the formulation except the incompatible material are compressed into a tablet. Means first step what is done? You are going to only compress the API. Okay. And in the second step what you are going to do? You are going to compress the excipients. Means anything which you add apart from the API, that is active pharmaceutical ingredient, it is called as excipients. Okay. So the another drug which is incompatible with your first API, that will be mixed with the help of suitable excipients, and then you will go for the next compression cycle. So this is how the multiple compressed tablets or layer tablets are prepared, so that you can avoid the incompatibility of the drugs. I hope this point is clear to everyone. Hello. हे समजलंय का तुम्हाला?
Yes, sir.
Yes, sir.
Okay. Okay. Now let's move to the Next,
Sir,
yes,
multiple compressed tablets example.
मल्टिपल कॉम्प्रेस टॅबलेटचे एक्झाम्पल्स तुम्ही तुमचे जे दोन ड्रग्स जे तुमच्या इनकम्पॅटेबल्स आहेत. फॉर एक्झाम्पल की जसं की तुम्ही म्हणता की एखादा ड्रग दुसऱ्या ड्रगसोबत इनकम्पॅटेबल आहे. जसं तुम्ही ज्यावेळेस फर्स्ट ते सेकंड इयरला असताना इनकम्पॅटेबिलिटी स्टडी केलेलं असणार आहे की आपण काय करतो की एक ड्रग दुसऱ्या ड्रगसोबत दिलं फिजिकली इनकम्पॅटेबल असतं किंवा केमिकल इनकम्पॅटेबिलिटी असते. तर नॉर्मली जे ड्रग फिजिकली इनकम्पॅटेबल असतात त्यांना आपण याच्यामध्ये कन्वर्ट करतो मल्टिपल लेअर टॅबलेट्समध्ये किंवा कॉम्प्रेस मल्टीलेअर टॅबलेट्समध्ये बनवतो. ठीक आहे. तर याचं एक्झाम्पल म्हणजे ज्यावेळेस स्पेसिफिक एक्झाम्पल तुम्हाला सांगायचं तर ज्यावेळेस तुम्ही कम्फर्टेबिलिटीज तुम्ही शिकले असता ना सेकंड इयरला का नाही
फर्स्ट इयरला सर.
शिकला ना तुम्ही फर्स्ट इयरला कम्फर्टेबिलिटीज.
हो.
तर मग त्याचेच एक्झाम्पल्स आहेत ते. सो फक्त इतकं लक्षात राहू दिस कॉन्सेप्ट इज दॅट a drug which is incompatible with another drug, okay, firstly the drug will be compressed, then the another API with the another drug with the other excipients will be compressed. Okay, now let's move to the third type of tablet. Now this is called as sustained action tablets. Now before going and seeing in detail the sustained action tablets, first try to understand. Okay, now we have something which is present inside. Okay, so and that is called as core. GABA म्हणतो आपण त्याला. Okay, so that is core. Okay, and at the outer edge you will have a film coating which is made up of a suitable polymer. Now this sustained action tablets are the tablets which after oral administration, when they are going to be given by oral administration, will release the drug at the desired time and prolong the effect of the medicament. Now these tablets when taken orally will release the medicament in a sufficient quantity as and when required to maintain the maximum effective concentration of the drug in the blood throughout the period of the treatment. And that's the major reason why we convert drugs into a sustained release action. Now suppose if you have certain drugs which has to be taken 3 to 4 times in a day, okay, due to because they have a lower biological half life, that is the T half is less. So in case of taking 3 or 4 doses in a day, it is better to take a sustained release tablet. And the classical example for the sustained action tablets are the diclofenac sustained release tablet. See, many a times, or in general, you may have noticed that whenever you see the label for the tablet's whole detail is given on the label of the tablet strip. So which kind of strip it is, okay, whether it is a strip packaging, blister packaging, means the strips contain all the information for the particular tablet. So sustained release tablets, what they are going to do, they are going to release the drug at the desired time and prolong the effect of the medicament. Clear? So what type of release pattern you want of a drug, okay. Now suppose if you want a drug to be released after a certain time span, okay, so that whole things you can have when you have a sustained action tablets, and this whole thing is done with the help of polymers. Now we use certain types of polymers. Now suppose if I want to prolong the action of my drug, so I am going to use certain polymers. For example, PVP polymer is there, that is polyvinyl pyrrolidone. I can use HPMC, that is hydroxypropyl methyl cellulose. So these polymers will be serving as will be helping us to prolong the effect of the medicament. And the classical example is the diclofenac sustained release tablets over here. Okay, now coming to the next type, that is enteric coated tablets. Okay, now instead of, let me jump this Presentation is incomplete from my side, so let me move to this part. Okay, can you see the Word document which I have shared with you? दिसतंय का?
Yes,
Yeah.
sir.
Okay, so the fourth type of tablets are which types of tablets? These are the enteric coated tablet. Okay, now enteric coated tablet, as in the beginning I told you that these are the tablets, okay, which are going to release its content into the small intestine. Okay, now these enteric coated tablets are the compressed tablets which are meant for administration by solving and are designed to bypass the stomach. Means enteric coated tablets have a special characteristics present into it, so they are going to bypass the stomach. Now suppose if this is the stomach, okay, so they are going to bypass. Bypass means what? They have such a polymer present that which is acid resistant. What we are going to do? We are going to apply a coat on a tablet of a polymer which is acid resistance. In our stomach, what is present? Acid is present. Everyone agree with this? Now these tablets are coated with the materials which are resistant to the acidic pH. And classical examples are of, you have to remember this a classical example, and the classical example is of cap. का example है cap, which is cellulose acetate phthalate. P is silent over here. Okay, so I repeat again, the polymers which are used for coating or which are used for enteric coated tablets are the polymers or the materials which are resistant to acidic pH, and the example is cellulose acetate phthalate. Many a times this question has also been asked into the competitive exams such as GPAT. So you should know that is cap is one of the material which is largely used for enteric coating of the tablets. So the tablets are coated with materials resistant to acidic pH of the gastric fluid but get disintegrated into the alkaline pH of the intestine. So you see how this whole thing is very important for us to know. Now when we talk about the stomach, okay, as it is acidic in nature, okay, so what is the basic motive when you go for the formulation of enteric coated tablet is to deliver the content into the small intestine. So in the small intestine the content should be delivered in this area. So what is the, as you know that a stomach have acidic pH, so when the dosage form is passing, means that is the tablet is passing through the stomach, it has to be resistant to the acidic pH of your stomach, and this work is done with the help of the suitable materials or the polymers which we are going to see. An example for this is an Lofnac 100 is an example of enteric coated tablet. Now coming to the fifth type of tablet which we are going to see, that is sugar coated tablet. Now everyone who is there in the class in one or the other form likes something which is sweet in nature. Okay, now sugar coated tablets, they are the tablets which are having a good shine, they have a good polish on them, okay, they have a very elegant look. Now these sugar coated tablets, they are complex tablets which contains sugar coating. Okay, now such coatings are done to mask the bitter taste or the unpleasant odor and the taste of the medicament. Now the sugar coating masks the tablet, makes the tablet elegant and also safeguard the drug from the atmospheric effect. And you can see in this picture how elegant the sugar coated tablets look. So they have a very nice shine present on them. Okay, normally you will find ibuprofen tablets, they are sugar coated, which we get in PHC, that is primary health center. So these are the sugar coated tablets which have a very good shine on them. Okay, they are highly polished. Okay, they have a elegant look. Okay, now coming towards the next type of tablet. The next type of tablets are film coated tablet. Now if you see these tablets which are shown over here, it looks just like an color compressed tablets, but this is not the thing. So the film coated tablets are the tablets which are coated with the help of a film forming agents or the film forming materials. Now this compressed tablet having a film coating of some polymer substances such as HPC, that is hydroxypropyl cellulose. Then we have HPMC, that is hydroxypropyl methyl cellulose. याला आपण HPMC म्हणतो, it is called as HPMC. It is HPMC. And then we have ethyl cellulose, short form is EC. The film coating protects the medicament from the environmental, that is the atmospheric effect. Then film coated tablets generally are tasteless, have little increase in the tablet weight, and have less elegance than that of sugar coated. Now when we are going to learn the next chapter from this unit only, that is coating, sugar coating as well as film coating, these two types we are going to discuss in detail. So when we compare this both film coating and sugar coating, the overall increase in the weight of tablet is very less. Okay, so only 3% of increase is there into the core of the tablet as compared to 50 to 80% of increase in the weight for the sugar coated tablet. And this film coated tablets are less elegant as compared to that of sugar coated tablets. Now moving further, now chewable tablets. Now chewable tablets, I think so everyone may have at least once in a life have taken a antacid tablet of Digene. घेतली का कधी तुम्ही Digene ची tablet? Okay, which is an antacid. Okay, so these are the tablets which are required to be broken. Now firstly what happens in chewable tablets? Firstly they should be broken down. So with the help of teeth they are broken down, and then they are chewed in between the teeth before they are ingestion. So before the ingestion of the tablet is done, okay, what we have to do, we have to first broke them, okay, and chew them between the teeth. And these tablets are given mainly to the children who have difficulty in the swallowing, and to the adults who dislike swallowing. So this is one of the advantages which chewable tablets give. This tablet should have very acceptable taste and flavor, so that the palatability of the chewable tablet is good, as well as the compliance rate for the doses regimen will be more. And the classical example for chewable tablets includes the antacid tablets such as Digene. Now let's see the next type, that is tablets which are used in oral cavity. Now the tablets which are used in oral cavity, the first example is of buccal tablets. Now these tablets are to be placed inside of the cheek, that is the buccal pouch. Now for example, if these are the teeth, okay, if these are the teeth, okay, between the teeth and the cheek, okay. Now suppose this is outer layer, so we have a pouch over here, okay. So this pouch is called as buccal pouch, where these buccal tablets will dissolve and slowly erode and are absorbed directly into the buccal cavity without passing into the alimentary canal, that is the GIT. Therefore these formulations, they are formulated in and compressed with sufficient pressure to give a hard tablet, and the example of the buccal tablets includes the progesterone tablets. So These are the tablets which are going to be placed inside the cheek, that is the buccal pouch, where they get dissolved or erode slowly and absorbed directly into the buccal cavity without passing into the alimentary canal. And they are formulated in such a way that the compression rate is sufficient to make the tablet hard enough. And the example is of progesterone tablets. Now you can see over here, as I told you, this is, हे दिसतंय का सगळ्यांना? थांबा मी मोठा करू का पिक्चर? लेट मी मेक इट बिग. Can you see the picture? Okay.
Yes, sir.
Okay, so this is the buccal pouch. Okay, so in this buccal pouch, what is, so these are teeth. Okay, and here you have kept the tablet, that is the buccal tablet. Okay, so these are the pictures of a tablet which is just applied. So after 1 hour this happens to the tablet, after 5 hours this is how what is happening to the buccal tablet, and after 10 hours this is what you are going to see. So and the classical example for buccal tablet is of progesterone tablets. Then coming to the second type from the tablets which are given in the oral cavity is of sublingual tablets. Now sublingual, आता एक लक्षात राहू द्या तुम्हाला, just for your remembrance. Okay, sublingual means beneath the teeth. Okay, beneath the tongue, sorry. So these tablets are to be placed under your tongue. Now when you are going to place this tablet, okay, so today after completion of this lecture or after completion of our whole year lectures, you please see where the areas are there for these two things. One is sublingual, which is beneath your tongue, and second one is the buccal pouch cavity. Now buccal pouch cavity means the cavity which is on the upper side of your teeth, okay, between the cheek. So where you are going to place the buccal tablets. Okay, now the sublingual tablets, they are placed under the tongue where the drug will get dissolved or disintegrate quickly and absorbed directly without passing into the GI tract. It means this is one of the tablets, okay, one type of tablet which will be bypassing the GI tract, okay, totally bypassing the GI tract, that is sublingual tablets. An example of sublingual tablets are the famous tablets, that is the nitroglycerin tablets. Then other types of drugs which are given in the form of sublingual tablets include isoproterenol hydrochloride and erythritol tetranitrate. So these are the drugs which are given in the form of sublingual tablets. Then we have the next type of tablets that is given in oral cavity. Now this example you will like a more. Now everyone have at least once in a life they have taken strepsils. Okay. Now strepsils is an example of dry cough lozenges. Now these lozenges tablets are designed to exert a local effect in the mouth or throat. So for specifically for giving local effect, we are going to use lozenges tablet. Now these tablets are commonly used to treat sore throat or to control coughing in common cold. They may contain local anesthetics, antiseptic, antibacterial and astringent as the API or the drugs from these categories. They are prepared by compression at a high pressure by a molding process. Now this is one type of a tablet. We can classify tablets on the basis of the method by which they are prepared. First one is compression and second one is molding. So one of the tablet which is prepared by molding process is lozenges tablet, and they generally contains a sweetening agent, flavoring agents and a substance which reduces a cooling effect. An example of the drug which produces, okay, it is produces, okay, PRO, which produces a cooling effect. An example of the drugs includes, means the dosage form includes Vicks lozenges, then the strepsils, okay. Then coming to the fourth type is your dental cones, okay. So these are the compressed tablet meant for placement into the empty socket after tooth extraction. So normally these are just like an teeth only, okay. So after tooth extraction, they are placed over into that empty socket from where the tooth has been extracted. Now they prevent the multiplication of bacteria in the socket after the extraction of tooth by using slow releasing antibacterial compounds, or to reduce the bleeding, which contains the astringent agent placed into the dental cones. Now this is how the dental cones look. You can see, so they are just like a cap, okay. So this is, here you can see, here you can see. So these are your dental cones, and they contain an excipients such as lactose, then sodium bicarbonate, then sodium chloride, and this cone generally dissolve within a time span of 20 to 40 minutes. Then the other two types of tablets which are remaining, another two class. One is the tablets administered by other routes. So the tablets which are administered by other routes, firstly it includes the implantation tablets. Now these tablets, implantation tablets, are placed under the skin or inserted subcutaneously. So when you are going to place it under the skin, it means you have to go for the minor surgical operation. Or if you are going to insert also, you have to go for the minor surgical operation, and they are slowly absorbed. And they may be made by heavy compression, but are normally made by fusion. Now one of the prime important criteria for implantation tablets are that this implant must be sterile in nature, and they should be packed individually in sterile condition, because directly the tablets, that is the implant tablets, comes in contact with your blood circulation. So here, as you are going to keep this whole thing beneath your skin with the help of a minor surgery, okay, so there are more chances that there can be infection. That is the reason this should be sterile in nature, okay. So subcutaneous route is one of the route by which we give a parental drugs also. So implants are mainly used for administration of hormones, that is the hormonal drugs such as testosterone, which is a steroid which is used for contraception. Now these tablets are very usefully exploited for the birth control purpose in human beings. Now the basic reason why they are given in the form of implant tablets. Now, for example, when you talk about testosterone, it is the steroidal drug which is used to as an contraceptive, okay. Now these tablets are used as a contraceptive, okay, because it has been used successfully for the birth control purpose in the human being. So if you insert it beneath the skin of the patient, there is of a person, there is no need for the patient to take the tablets on a daily basis. So this is one of the advantages which we can have for the implantation tablets, okay. The disadvantage of implant tablets include are the changing rate of drug release. So you can see that the drug release pattern will be changing with the change of the surface area, and the possibility of tissue reaction can also be seen. So dose dumping can be seen, and this is the example of a implantable naltrexone, okay, drug, which is given as an implant tablet. So you can see this is a tablet, okay, which is given with the help of subcutaneous route, okay, and the drug name is naltrexone. Then the second type of tablets which are given by other routes, it includes vaginal tablets. Now these tablets are meant to dissolve slowly in the vaginal cavity, okay. Now the tablets are typically oval or pear shape, for the easy insertion into the vagina. These tablets are used to release the steroids or the other medicinal agents such as antimicrobial agents. The tablets are often buffered to promote a pH which will favor to the action of the specified antimicrobial agents which are going to be added into the formulation of vaginal tablets, and the content easily gets solubilized in the vaginal pH are used, such as lactose and sodium bicarbonate. And the example for the vaginal tablets are the gynotricoside, which contains a drug that is triconazole. Then we have clotrimazole cream, which is known by a brand name that is Mycotin. Okay, so these are the other types of tablets. And coming to the last type of category, I think so the fourth category we'll discuss later on, because already we have 5 minutes. We have taken 5 minutes extra. So we'll stop over here for